Hello there, we're here today to talk about acne and Aknicare. How it works, what it does, and how it's helped these guys. Now I'm joined by Professor Chu and skincare consultant Samantha Bravey. Hello, how are you?
Very well, thanks.
Thank you for joining us. Now, firstly, Professor Chu, tell us about acne and what actually happens, how it actually comes about.
Okay, a lot of myths around acne, but acne is essentially a disease of the skin. It's commonest in adolescence, but it can extend right the way through to old age. My oldest patient is 85 and she's still got acne.
Oh, bless her.
Waiting to grow out of it still. Now, it's essentially a reaction in your skin to male hormone. Whether you're male or female, you've still got a lot of male hormone knocking around. And when you get high levels, particularly at puberty, sometimes with contraceptive pills, sometimes with pregnancy, it can cause changes in the skin. Now, acne often runs in families, and I'm not sure whether you have parents with acne, and therefore you can blame them for it. But with acne, you often get a familial incidence, and when you get acne, there's a change in the skin. So instead of the skin reacting normally to the male hormone, you get an increased oil production, blockages within the skin pore that allows the oil to drain onto the surface, and that pooled oil becomes inflamed and infected, and that gives you your zits.
Okay, so there's many different things that can actually trigger off that, like the hormonal imbalance. Is that basically what starts it?
It's not actually a hormonal imbalance. You know, the vast majority, men for instance, never have a hormonal imbalance. Their hormones are completely normal. Women, 30% of women can have a slight increase in male hormone because of polycystic ovary syndrome, but 70% are normal. It's that overreaction to the male hormone that causes the problems. And that can be triggered by changes of puberty, stress, major problem. When you're under stress, the adrenal gland that also produces male hormone produces more male hormone, and that can trigger the whole reaction.
Right. Well, tell us about the various skin complaints that can actually happen.
When you first develop acne, the first thing that happens is the oil gland, the sebaceous gland that feeds into the hair follicle, overreacts to the male hormone. You produce too much oil, so you get a greasy skin. And it's mainly the male hormone that triggers that, but if you're in a very warm environment, then you find your skin is even greasier. Second thing, and the most important thing in the development of acne, is a development of a blockage in the skin pore. Now, it's nothing to do with dirt and grime, so it doesn't matter how you wash your skin. It's due to an accumulation of dead skin cells in the pore, and that literally dams back the oil so the oil can't escape the way it wants to, and the oil eventually then pools. You can actually feel the pressure building within the follicle, and bacteria that are present within the follicle then start dividing madly, and your immune system eventually reacts and you get inflammation. Eventually, as part of the inflammation, the body recruits white blood cells and you get pus formation, and if you're lucky, the pus bursts out onto the surface and it all settles down. If you're unlucky, it can burst inwards and that can lead to scarring, and the scarring is permanent unless you have it treated.
What's the most common thing that people come to you with, going, oh, I've got this problem, what do I do?
Well, it does tend to be acne, and it normally tends to be the client that has been through a whole range of home care or sort of shop-bought remedy as well. So they will normally follow a certain path and generally have attacked the skin and attacked the skin and attacked the skin without really having an understanding of how acne works and how their skin works and how to treat acne. And they need to do it in a way that will work kind of synergistically with their skin at the same time, so they're not just stripping their skin, they're not taking the kind of the normal function of the skin away. They need to work with it as well.
So with Aknicare, Professor Chu, what's the process and how do those products make such a difference?
I think the beauty of Aknicare is that it's a very natural product. And the way it works is in multiple different ways. It changes the pH within the hair follicle so that stops the bacteria from dividing, and that's very important. So it acts almost like an antibiotic, but it's also really quirky in that it suppresses the enzyme that controls the male hormone effect on the oil gland, and so it is the only topical agent I've ever found that actually reduces oil production within the skin. And the linoleic acid also helps to unblock the pore, so it really works in all stages of acne development. Suppresses the oil production, reduces the bacteria, gets rid of the blockage, so everything eventually drains normally.
If you are wanting to use Aknicare, there are 6 different products.
Yeah.
And it needs to be jiggled to fit your type of acne.
Again, you have to experiment and find out what's right for you.
Yeah.
Everybody's individual and everyone's different.
Exactly.
Yeah.
So the Aknicare lotion, as Professor Chu was saying, contains antibacterial, sebastatic effect ingredient, and you have to follow that with the Aknicare cream, which has the moisturising capability in there. It also has some antibacterial in there as well, but it's almost keeping the pH of the skin regulated is really important. Keeping the water flow in the skin is really important as well. The water loss through the skin with acne is way speeded up. That's the whole point of using the 3 products all together as well, that you couldn't just take the Aknicare lotion off of the shelf and expect it to do all the job, because your skin doesn't work like that. You need to put everything in that your skin needs, and it does need to have this sort of this water travelling through it for all the cell nutrient waste transfer, everything to work. It needs that water in there.
Talk to us about the whole antibiotic situation, because that's fascinating.
Okay, a problem in the UK in particular is that general practitioners are not terribly well trained in dermatology. I train medical students, and they get literally 2 weeks of dermatology in their entire medical training, and then they're thrown out into the community and they're expected to treat all these complicated skin diseases, and they often don't know how to do it properly. The vast majority of patients, when they go to see a doctor for their acne, are given antibiotics. And antibiotics can work by suppressing the bacteria, reducing inflammation, but we're now seeing problems with antibiotic resistance developing in the bacteria, so patients are not necessarily responding well. Also, long-term antibiotics can have an effect on your whole body, and problems with the gut can arise. Women can get vaginal thrush, etc. So that can be a real problem.
It's becoming more and more of a problem, actually, isn't it?
Oh, absolutely. And of course, antibiotics have no effect on the blockage in the pore, which is the primary problem. And therefore, we often have patients who are sent to us and they've been on antibiotics for months or even years, and yet they've still got bad acne. And it's because they haven't addressed the core problem, which is the blockage in the pore. I think the problem with acne is that there's an awful lot of misinformation out there. A lot of adverts will promote agents that will potentially make things better, but quite often are fairly toxic to the skin, and they don't tolerate well. But also the myth out there is, oh well, don't eat sweets, don't eat fatty foods, and it will get better by itself, which is rubbish. You know, if you've got acne, you need to get it treated as soon as possible. The real problem with acne is that it can scar not only the skin but also the psyche. And the psychological trauma of having acne is massive.
So such a massive loss of confidence,
absolutely.
Of course. Yeah.
But so often, you know, somebody will go to their doctor and they'll say, I've got a problem of sorts. And, you know, we've had reports back from some of our patients, oh, well, it'll get better. You know, I had acne when I was a kid and it got better. You know, go away. And they don't even treat it, which is crazy. So you need to go out there and get what you need.
Thank you, Professor Chu and Samantha.
You're welcome.
Join us again for more information on managing your acne.